Welcome back to Midday. Well, if you've been looking around this month wondering why so many men have a beard or growing out maybe a mustache or a goatee, it's Movember, and it's to raise awareness for men's health issues. These two gentlemen next to me have good-looking beards going. You too. This is Dr. Robert Wayment. He's a urologist at the Ogden Clinic, and we also have Bryce Blanch here. He's a patient there and also a cancer survivor, and you guys were talking prostate cancer today. What is that? Let's start there, doctor.
Well, prostate cancer is the most common solid organ cancer that affects men in the United States. It can be up to 1 in 6 men throughout their lifetime. It ranges from a really aggressive to a more benign type cancer that we can watch, but in patients like Bryce, we're sure glad that we caught it early so we could treat him.
Perfect. I want to ask you, everyone knows that we should be getting checkups like the women's health breast scans. What do men need to do to go in and get a checkup? How does it work?
Well, it starts with your primary care physician. You just express interest. They can start the initial screening. The initial screening is a blood test called a PSA test, and then a digital rectal exam.
Okay. Bryce, how did you find out that you had prostate cancer?
It was by accident. I had heat exhaustion. They diagnosed me with that at the hospital. They did a lot of tests on me, couldn't figure anything out, and my main doctor said, let's do a PSA, which I did, came back at 9.8, and they sent me to see Dr. Wayment.
What should it be?
What, under 2?
It should be less than 4, but for a man as young as Bryce, even lower. So.
Wow.
Is this tough to talk about? Is this not something you want to go to your doctor and say, let's get this done?
It's very easy for me to talk about now, but back when I first went in to see Dr. Wayment, I think you kind of got to leave your pride at the door when you walk in to do it.
I was about to ask you that, because you said you were feeling, what, overheated, and did you think that it was anything else but maybe a little bit of exhaustion, maybe vitamin deficiency? For you to think prostate, did that even enter your mind?
No, not at all, because it's not even one of the symptoms.
Yeah, that's right. Well, and in Bryce's case, that was kind of a red herring, the heat exhaustion, all that kind of stuff. That was a whole separate issue. That just led them to check this, which didn't really relate to what he was currently experiencing.
What are the symptoms?
Really, there's no symptoms initially. If you have symptoms from prostate cancer, it's usually progressed to the point that it's really dangerous. So that's why we do screening, because you can't tell otherwise.
Dr. Wayment, are more men getting screened? I mean, with Movember, with the awareness being brought to this, more people talking about it?
I think so. You know, it's whatever we can do. I don't do this just for fun.
It's itchy.
It's itchy for sure. But I really think that it plays a role in just getting exposure out there to the importance of men getting screened.
Bryce, I wanted to ask you, as a bloke who went in and had it done, do you think when we talk about things like this on shows like ours, is it more the wives or the girlfriends telling their husbands to go in for a checkup, or you just felt it was right for you, you know?
I felt, I mean, it's right for me. I think when you hit a certain age, you got to do it.
But men don't.
But they don't. And so I think I would tell the wives or girlfriends out there, send your husband or boyfriend and, you know, get checked, because it'll save your life. I'm great. 2 years cancer-free.
That's good.
Well, you being here is going to save someone out there, both of you. So thank you for being here today. OgdenClinic.com/urology if you'd like to talk to Dr. Wayment. That's the website, and we'll link you from our website. Go to 4utah.com. Now, I know a handful of guys here at ABC4, including our own Curtis Ray, have been growing out their facial hair to raise awareness for, of course, these men's health issues. If you would like to donate along with them, you can go to 4utah.com/Movember. And Curtis, are you cutting your beard live on the show?
Apparently it's happening on Wednesday here in the studio. Everyone's having a good old shave.
You guys can join us if you like.
Come on in.
We'll be right back.
Come on in.
Thanks.